This weekend, friends say a man killed by Tigard police was in a mental health crisis. We'll hear from them and authorities. Plus, Oregon calls in the National Guard to help get more COVID-19 vaccines to Oregonians. We'll look at how that process will work. But first, our Chris McGinnis joins us live at home with your forecast. Good morning again, Chris.
And good morning to you again, Galen. The morning forecast headlines or starts with fog. I want to give you a live look over in the Sunnyside area. This is the ODOT camera on I-205 near Lawnfield Road. It's kind of tough to see the cars passing by there, but the fog is pretty thick in some areas. In some areas, you're probably looking out your window and saying, what are you talking about? But it's patchy, in some cases quite thick, right? Quarter-mile visibility last check in Scappoose. Look at that, up in Chehalis. 0 visibility right now. Half-mile visibility in Aurora, McMinnville down to a quarter mile. So, again, not everybody's seeing the thick fog, but in some cases, the fog is quite thick. So that's why we've got the dense fog advisory. We go above the fog and look at that pretty sunrise in the offing here over downtown Portland. Our Wells Fargo sky camera shows the clear sky above and the low clouds below. It's 37 last check at the airport with a light west breeze. The east breeze will pick up a little bit today, and I think that will help scour out the fog even faster later this morning. 32 in King City, 34 in the Dalles, and in the big picture statewide, 17 in Baker City. That's one of the cold spots. Of course, you go up in elevation, it's really cold at Timberline. They're rocking 102 inches of snow right now with the base at Timberline. The plan for today, dense fog this morning, and then some sun breaks as we go towards the late morning and early afternoon. Galen, clouds roll in later today. There is rain in the forecast tonight. We'll walk you through that with Featurecast coming up in just a few minutes.
All right, Chris, thank you so much. We'll see you in a bit. New this morning, crews are searching for an airliner in Central Asia. They think it may have crashed, but they cannot find it. The plane took off from Jakarta last night, carrying 50 passengers and 12 crew members. Air traffic controllers lost contact with that plane soon after takeoff. Search crews have found some debris on Indonesia's northern islands. They're working to confirm if it's from that missing jet. We'll let you know. Friends of a man shot and killed by Tigard police this week want answers as to why he had to die. Police at the same time are pleading with people to be patient while an independent investigation plays out. All at the same time, protests are boiling over in a community that thought that this kind of outrage was reserved for bigger cities like Portland. Here's Maggie Vespa.
He has been very sick for a long time and has manic episodes.
Friends of Jacob McDuff knew he was struggling and feared for his welfare. But this was beyond their worst nightmares.
I've known him for 2 years, and in his mind, I was the only person who loved him.
Tigard police confirm an officer with the department shot and killed the 26-year-old Wednesday. Police had been called to McDuff's apartment complex on a domestic disturbance. The Oregonian reporting dispatch audio indicates police were warned callers had concerns about McDuff's mental health. In a news release, police said McDuff had a knife and resisted arrest. During a struggle, an officer shot him. Police aren't releasing more details right now. Friday, a memorial sat in front of his complex near Southwest Hall Boulevard and Bonita Road. A search of McDuff's background shows no criminal record. Neighbors told us police had been called to his apartment 5 times in the 2 days leading up to the shooting, all for mental health concerns. Police wouldn't confirm that detail. Wednesday, officers were on scene around 4 p.m. Neighbors said police were there for several minutes before they heard shots.
I stay put in my house. I don't want to get out.
You heard the gunshots?
Yes.
How many?
Maybe I just hear like 3 times.
The Washington County Major Crimes Team, which is separate from Tigard PD, is investigating the shooting. They have not yet named the officer who killed McDuff. We're told that's all standard protocol. Still, police know anger at their profession is historically high. Thursday night, protests erupted in Tigard. People smashed windows at police headquarters and businesses downtown. Friday, police said 10 to 20 businesses sustained damage. At a news conference, while crews boarded up windows behind her, the chief denounced the vandalism and urged people to let the investigation play out.
I'm not trying to skirt that. I understand people want answers. However, and it's frustrating for me as a leader of an organization to not be able to give those answers in a timely, but there is a process, there is a transparency. When I say transparency, it's not rushed to give information I don't even have.
That was Maggie Vespa reporting. Now, police expected more protests last night, but we didn't see any near police headquarters. This morning, police and federal agents are ramping up their investigation into who was involved during the deadly siege of the U.S. Capitol. One of the men seen as the face of the attack was arrested yesterday. His name is Richard Barnett. He took a picture with his feet on the desk of House Speaker Nancy Pelosi. You'll see him come up here in a second. There he is. Now, dozens have now been arrested and at least 55 people face federal charges. The House of Representatives, meanwhile, is prepared to move ahead with articles of impeachment against President Trump for the second time. Speaker Nancy Pelosi says she'll take swift action if the president does not resign himself. In the Senate, Majority Leader Mitch McConnell sent a memo outlining the impeachment procedure if it goes forward. And that's where things get tricky. The Senate is now in recess until January 19th, the day before Inauguration Day. Until then, impeachment trial proceedings are not allowed to start unless all 100 senators consent to an early return. Analysts say that's not likely. President Trump is accusing Twitter employees of coordinating with, quote, the radical left after the company permanently suspended his account. He also said he's negotiating with other sites and even considering building out his own social media platform. Twitter said it suspended his account, though, after a review found there was a risk of further incitement of violence. Oregon is calling in reinforcements to ramp up COVID vaccinations. The National Guard will step in with the goal of vaccinating 250 people per hour. By Tuesday, they'll be set up alongside Salem Health at the state fairgrounds. Right now, that clinic is only for people who live or work in Marion County. And no matter where you go, only people in the 1A group can get the shots right now. That includes healthcare workers, first responders, and people living and working in nursing homes. The Guard will also deploy mobile teams to help give shots around the state. In an update from the Oregon Health Authority yesterday, we learned the state has received about 250,000 doses of the vaccine so far, and it has used 73,000 doses.
OHA has delivered vaccine doses to 190 sites across the state already. We'll allocate vaccine doses to an additional 30 sites next week, including hospitals, local public health agencies, federally qualified health centers and rural health clinics, urgent care clinics, retail pharmacies, and emergency response agencies.
After the 1A group is vaccinated, teachers will be up next. Well, because healthcare workers are first in line for the COVID vaccine, specifically those who come in contact with patients and are most at risk, many of you have wanted to know why some hospital administrators and people in the marketing departments are also getting the shots early. Turns out the Oregon Health Authority told our Kristen Severance they shouldn't be.
As soon as the vaccines started in Oregon, so did the social media posts. People excited to be getting vaccinated, posting pictures of themselves. Then came the emails from people asking why an OHSU marketing employee was getting the vaccine or an administrator at Providence. Viewers wrote us asking, I just don't understand how people who are working from home have access to the vaccine before the true frontline workers or 30-somethings who are at no risk are getting vaccines while elderly, sick people wait and wait and wait. In a news conference this week, the Oregon Health Authority said what they thought was an isolated incident was more widespread.
We have become aware of vaccinators vaccinating staff going beyond the 1A category definitions.
OHA's Patrick Allen said that should not be happening.
Actually quite a bit more widespread. And so we're providing some very direct guidance out to vaccinators that we are still in category 1A and that we shouldn't be moving on to people who don't have patient exposure.
Federal guidelines adopted by the state of Oregon put people with direct contact with patients at the front of the line, but health systems were left to interpret the rules in their own way. And hospital systems were not hiding these vaccinations in any way. It was all part of OHSU's plan to vaccinate all employees in 6 waves. The employees in waves 1 to 5 had contact with patients. The employees in Wave 6 did not. OHSU started vaccinating Wave 6 on January 4th. Providence said they were following OHA guidelines from December 18th, pointing to a highlighted section stating healthcare personnel include but are not limited to EMS, nursing assistants, clerical, administrative, billing, and volunteer personnel. Providence said the administrator on social media had volunteered at a clinic for 8 hours at the end of December, welcoming and checking people in to be vaccinated. Legacy said they are only vaccinating patient-facing staff, not staff with outpatient contact. Kaiser said they are focused on frontline healthcare workers or first responders. And as for the VA Portland healthcare system, Director Garwin Goodspeed said they are vaccinating all employees and will continue with that plan.
Was the VA or is the VA giving the COVID vaccine to, employees who are not coming in contact with patients?
Yes, we are. The COVID vaccine is useless unless it's in someone's arm. So the vaccine sitting in a freezer doesn't help anyone. Many of our employees aren't direct patient facing, but they come into the hospital every single day.
The VA works closely with the OHA, but takes their cue from the federal government.
They're going to send out expanded guidance. Will the VA be changing the way they do things?
No, absolutely not. VA is following the guidance from VA. We partner with OHA very, very closely, but we're a federal entity. We respect their position and where they're going from a state perspective and figuring out how to cover as many people as they can. We have figured out how to get 80% of our patient-facing staff vaccinated.
And the Surgeon General, Dr. Jerome Adams, told NBC he feels states are actually too beholden to the guidelines, and states should be vaccinating as many people as possible.
So your headline today really should be Surgeon General tells states and governors to move quickly to other priority groups. If the demand isn't there in 1A, go to 1B and continue on down. And if the demand isn't there in one location, move those vaccines to another location.
Further proof, this entire vaccination process gets more muddled and confusing by the day.
Now, OHSU said that it's following a vaccination plan approved by the state, and it's also partnering with organizations like the Oregon Dental Association and others to help vaccinate more healthcare providers. We'll be right back.